Hello and welcome to Rehab and Recovery with Dr. Miles Sandoval. I am Dr. Miles Sandoval and I'm super excited to have Dr. Mel on with me today. Dr.
Hello.
Mel is a pelvic floor physical therapist, and we're going to help break down some of the taboos about the common pelvic floor problems that people encounter in recovery from eating disorders, in recovery from substance use and addictive behavior. So, Dr. Mel, would you like to tell us a little bit about what it is you do on a day-to-day basis and what it is you see on a day-to-day basis?
Sure. I don't know if we have enough time for all of that, so I'm going to give you the shortened version. So I am what's called a pelvic floor physical therapist. I specialize in pelvic floor dysfunction, and that can range from anything between urinary incontinence, fecal incontinence, constipation, pelvic organ prolapse, diastasis recti. I know I'm missing a couple, but all of that kind of stuff. Pain with sex, any kind of groin pain, that kind of stuff.
Yeah, that's a pretty good smorgasbord, huh?
Yeah.
So before our male viewers log off, we know that eating disorders and addiction don't discriminate by gender or by other demographic information. But today we are going to talk about bedwetting after binge drinking. And unfortunately, that is an equal opportunity issue that people can run into.
Hmm.
Do you see males in your practice? Or
In
is
my
that
practice, I don't. I'm not trained in male pelvic floor dysfunction, but that is definitely a realm because just like women, if you have a pelvis, you have a pelvic floor, and that includes males too. So,
so? I'm glad you mentioned the training, because not just any PT off the street can go sign up for pelvic floor physical therapy. Would you like to tell us a little bit about the kind of training that you've been through, the kind of training that is ongoing?
sure. So I was lucky enough in my doctoral program for physical therapy, our school had a pelvic floor component to it. And not only did we get the coursework in it, we also had live models come in so we can practice some stuff on them. I also did a clinical rotation full time in pelvic floor health. And then after I graduated, I took a bunch of intro to pelvic floor health and more advanced courses. So as a PT, you have to keep up your credits depending on your state every so often. And mine are always in pelvic floor stuff. So I'm constantly learning and it's constantly changing. It's a pretty new realm to PT. So keeping up on everything is really key.
I think there's a lot to be said for having that positive mindset, having that growth oriented mindset that
Mm-hmm.
none of us is ever going to get to a point in our career where we officially know everything, because it keeps changing
Exactly.
and hopefully changing for the better.
Mm-hmm.
So, before we get any further, would you like to share a little bit about what the pelvic floor is exactly?
Oh,
Because,
yes.
yeah.
I should have wrote my model in. So the pelvic floor is basically a supportive bowl for your organs. So you have your pelvis, and inside are there's muscles in there, there's ligaments, there's nerves, and people don't understand that the muscles in there are what's supporting things like your bladder, your rectum. For women, it's the uterus. And having that strength is really, really important, but also having that laxity is important because just like any other muscle in the body, you want to have a good ebb and flow between the two to maintain health in that section, if that makes sense.
It does. And I think with a lot of other big muscles too, it sounds like what you're aiming for is good strength that's also flexible enough to
Right.
be able to turn the muscles off when that's needed and turn the muscles on when that's needed.
Absolutely. So a lot of people think like, oh, pelvic floor therapy, I'll just do a bunch of Kegels, and it doesn't work like that. Kegels aren't always appropriate. You need like just like any exercise program, the proper like dose, the proper amount, and all of that stuff. So it's just like any other part in the body, except it's in a quote unquote weird spot that we never think about.
But you end up thinking about it a lot if you're struggling with pelvic floor pain or incontinence, I'd imagine.
Absolutely. And then another thing too, just to point out, I'm glad you mentioned that. A lot of people are told that issues like pain with sex and incontinence are normal when in fact they're not. They're just really common. So if an MD or somebody is telling you like go home with this dilator and you'll be fine, it doesn't work like that. Like there are people like us that help. We're just not very well known yet as a realm because we're so new. But it's definitely stuff that we can help with.
So with your clients, how long have people typically been dealing with their pelvic floor problems by the time they come to see you? And I know that's a big question because
Yeah.
everybody's different.
It really depends. So I have women who are in their 60s who have been dealing with this since their teens. I have a 14-year-old right now who started when she was 11. I have a woman in her 30s right now who has been dealing with it her whole life. So a lot of it, like it's very rare that I get somebody who sees this problem and they've only been dealing with it for a year and they seek help for it. It's usually a lot longer than that.
What do you think are some of the reasons why? And I know you touched on getting dismissed
Hmm.
by even a professional earlier, but what do you think are some of the reasons why people don't seek care sooner?
I think part of it is they don't understand what their available resources are. And I think a lot of it also has to do with their nature. So, like what they grew up believing. If a lot of the cases, if they see a parent has gone through this, they think it's normal. So it's like, okay, well, my mom was peeing her pants when she exercised. So I am too. Not a big deal. Friends like get into the mix too. I spoke about this in one of my Instagram posts. There was a woman who went to the grocery store and she peed herself, and everybody was laughing, and they're like, "Oh my god, that happens to me too, haha!" But it's just not. It's not normal, and people don't realize that beyond meds, beyond surgery, beyond wearing a pad for the rest of your life, there is help for all of this stuff. And I think that they don't know where to go, and when they do go, the dismissal is a big part of it. So yeah, it's tough.
It is. It can be really tough to try to advocate for yourself, especially if you're getting a dismissed message from a professional, right?
Absolutely.
And
Yep.
it's like, oh, okay, I guess I shouldn't worry about it. And I think you make a really good point that it's not normal or it's not something that people just have to put up with. So I guess in my kind of language, I would say that statistically, it might be normal for adult women. But in the same kind of way that, you know, yo yo dieting and joking about body self loathing is kind of statistically normal for adult women, but
Hmm.
not really, not the future that I would hope the next generation to grow up in.
Right.
And so, as we kind of talk about wetting yourself at the grocery store or wetting yourself while exercising, I wanted to kind of lay out some of the common pelvic floor issues that people run into when you start to mix eating disorders in the pelvic floor, or when you start to mix substance use in the pelvic floor. Um, and this is not like pop quiz 101,
Uh-oh.
but no. I so I'm aware that alcohol is a big bladder irritant. Is that
Yes.
correct?
Yes.
Are there any other substances, medications, or just like daily foods and drinks that are also can be really irritating to the bladder?
So coffee's a big one, tea, artificial sweeteners, citrus, spicy stuff, chocolate, all the fun foods are bladder irritants, but alcohol is definitely a big one.
Yeah, so in kind of the recovery sphere or in the intersection of pelvic floor and substance use, the big one that I'm aware of being a problem is bedwetting after binge drinking.
Hmm.
And kind of like you talked about, for some people, as soon as you remove the irritating substance, then the problem kind of goes away on its own. But for other people, it seems like once that bedwetting habit gets formed, it doesn't matter if you take away some of the irritants. People can still end up with their brain stuck on bedwetting.
Yes.
Why does that happen?
I'm thinking about urge incontinence and liken it to that. So with urge incontinence, that's when you feel like you have to rush to the bathroom, and when you go, it's like two drips, and you don't have a bladder infection, you don't have a UTI. It's your nervous system is trained by whatever inputs coming in to give your body that signal that you have to rush to the bathroom and go, even when you don't actually have to go. So I'm wondering if that chronicity with wetting the bed inputs that into the nervous system so that when either you're sleeping or something hits that signal, it signals your pelvic floor to relax and then you wet the bed. I'm not sure. That's me speculating, but I think that might be part of it.
Yeah, and I appreciate your authenticity and sharing. It almost seems like to me that once the brain has decided that it's okay to wet the bed without engaging wake up procedures,
Yes.
that sometimes that can be the new pathway that gets taught, whether intentionally or unintentionally.
Mm-hmm. Absolutely.
Is there a way that people can retrain that pathway?
Yes, you can. Um, but it takes a lot of work and a lot of time. And that's what a lot of people get frustrated with that because any pelvic floor dysfunction, there's so much wrapped up in it. It's like literally an entire body makeover, including psyche. So, being in touch with a really good therapist, getting to the root of every issue that might be going on as well is so important with pelvic health and pelvic floor recovery. And I think a lot of people don't understand how important everything together is as one package.
Yeah, you can't really ever separate body parts and just treat the one body part, right?
Right.
So in the recovery sphere, I feel like pelvic floor health can sometimes fall by the wayside just
Mm-hmm.
because it often feels like there's bigger fish to fry if somebody is a danger to themselves, or if somebody's not medically stable, if somebody's having immediate negative consequences in their life because of disordered eating or because of addictive behavior. Then even if somebody is wetting themselves on a daily basis, I can see how it would almost kind of fall off the
Mm-hmm.
radar, which is unfortunate. But it sounds like with consistency and some perspective that people can start to train things in a different direction.
Right. And having a strong team to address each component and have everybody be on the same page, that is so valuable in any pelvic floor recovery, especially if you've been dealing with issues for decades.
It can be hard to find too,
Yeah. Yes.
but once you do, definitely worth holding on to, right?
Mm-hmm.
So I wonder if you could speak a little bit about the pelvic floor dysfunction that tends to happen after atrophy, because the one of the really common pelvic floor dysfunctions that happens both during and after anorexia is that, along with kind of the rest of the muscle atrophy, including the heart muscle, a lot of people experience atrophy of their pelvic floor muscles as
Mm-hmm.
well. And it seems like once you cross a threshold of atrophy, it's like if your arms were getting weaker and weaker, and at a certain point, you can no longer hold up, the 10-pound weight or whatever. It seems like once that threshold is crossed, the poor bladder muscles just can't hold in the urine anymore.
Mm-hmm.
And kind of like with alcohol, it seems like for some people that concern goes away on its own as people are restored back to physical health, and as people restore their weight. But just like with the alcohol and bedwetting, seems like for some other people, they just kind of get stuck on incontinence mode.
Mm-hmm.
So is there anything that people can do at home, or would you like to talk a little bit more about the kinds of pelvic floor problems you see with that muscle atrophy?
Right. So, a couple of things come to mind with that. One being the incontinence. So ideally, when the bladder is filling, your pelvic floor muscles should be contracting to assist with that, like support of the bladder. And if those aren't able to support that, then you risk that leakage and all that good stuff. Not so good, but but there's definitely retraining like any other muscle as you build up with the proper nutrition and everything. Same goes for the pelvic floor. Another thing that comes to mind is what's called pelvic organ prolapse. So, again, because the muscles just don't have the nutrition and they're atrophied, the organs then tend to come through the vaginal opening. And this could be the rectum, the bladder, or the uterus. And what that feels like is like if you've ever used like a tampon and it's been sitting in there for so long, it feels like a heavy tampon that's just like coming down. And sometimes you can see the prolapse, sometimes it's just a heavy feeling. But again, you don't have that supportive structure to be there um, to give that support. So for clients like these, I never like to give like, oh, this is what you should do, this is what your program should look like, because atrophy in disordered eating behaviors, especially over time, occurs all over the body. So the pelvic floor is part of your true core, like I like to call it. So it works in conjunction with your deep abdominals and the lower back muscles for stability and all that good stuff. So you really need like a full body assessment. What do your hips look like? What's the range of motion, the strength? What does your lower back look like? Range of motion, strength, stability, all of that stuff in conjunction with the pelvic floor. It's kind of like a whole body program, if that makes sense. I know that was very long winded.
No, that really does make sense, because just like I think largely we've kind of gotten over the myth of like spot reducing
Yeah.
or spot dieting fat in just one area without any other places.
Mm-hmm.
I think you're painting a picture where atrophy tends to occur to kind of from head to toe. But then
Right.
the flip side of that is that strengthening and recovery and restoration can hopefully lead to a more positive outcome for the future. Is that
Absolutely. And
accurate?
just like you can retrain any muscle that we're more familiar with on the body, biceps, hamstrings, butt, whatever. Same thing for pelvic floor. It's not a lost cause if you've never learned how to engage those muscles. It's never too late, just like it's never too late to strength train or do any of the other things. Pelvic floor is no different.
Awesome. I think that's a really positive message to hear.
Mm-hmm.
Um, I hear a lot of people in across the board who are worried that whatever their problem or concern is, is it too late? Have I broken it? And
Right.
now it's unfixable.
I always say no. I'm very stubborn too, so
It could be a really good thing in this
yeah,
case because it sounds like it's a little bit of a mystery or peeling back some different layers.
absolutely.
So, talking about the true core, is that you've got the abdominal muscles on the side, the diaphragm on the top,
Mm-hmm.
and the pelvic floor on the bottom, right?
Mm-hmm. And then you have your lumbar, lower back too.
So it's a nice little barrel there, right?
Exactly. Yeah.
Awesome. So and again, we don't have the time to cover all the possible topics. So there's stuff that we're definitely going to overlook. But you can always leave a comment, and I'm sure Dr. Mel would be happy to answer after the fact.
Mm-hmm.
So in bulimia, but it's not the only case where people kind of lean on the Valsalva maneuver. One of the common problems is that people will use the Valsalva maneuver while purging, and along with kind of belly button hernias uh, and other side effects, people can end up. Would you like to tell us a little bit about what the Valsalva does to the pelvic floor? Because you'd know this one
Absolutely.
better than I would.
So the Valsalva is a fancy term that we use to call like holding your breath. So what happens is there's so much pressure from holding your breath. There's so much pressure in that abdominal cavity that your true core gets to take a vacation pretty much because it doesn't need to engage the breath. That pressure from the breath is doing all the work in addition to putting pressure on the pelvic floor. So over time, that compensation is learned. And then as you can tell, like you're not using your muscles the way they should be. So they might get weak in the process. And this is why we see a lot of incontinence in like weightlifters too, because every time they go to lift that load, they hold their breath. So like it sounds so hokey and people look at me like I have five heads when I tell them this on day one. We work on breathing because a lot of people don't know how to breathe, especially like I notice in a lot of patients who have gone through bulimia during purging episodes, if you're contracted and you're trying to get everything out, you're contracting those pelvic floor and the abdominal muscles too. So you might have a tight and a weak pelvic floor at the same time, which it sounds crazy, but it can definitely happen. So we kind of try to teach you how to fill up that abdominal cavity with air because you're probably not used to doing that and kind of getting that full excursion back in the abdominal cavity and then working on the strength piece later, if that all makes sense.
It does make sense. And I forgot to explain what the Valsalva maneuver looks like. So everybody's familiar with it, even if it's a big fancy word. And I think to explain the Valsalva in a moment, um, the Valsalva maneuver is when you close your mouth, close your nose, and go, and you push air down. And people can get in the habit of doing this, like you said, when they're lifting stuff. It can be when purging during bulimic behaviors. Is there other are there other situations where people tend to kind of lean on the Valsalva when they might not have the pelvic floor muscle strength?
Mm, the only thing I could really think of is like lifting stuff. Um, yeah, that's about maybe like through high impact. So if you're going for a long jump or something, or jumping in general, that might happen.
So the moral of the story, it sounds like, is don't hold your breath
Exactly.
unless you're underwater.
Pretty much. Yeah, don't breathe
And
when you're underwater.
yeah, do hold your breath. So in your practice, have you seen any other pelvic floor problems that, as you peeled the layers back, ended up being related to disordered eating behavior or substance use?
Um, actually, so I don't discover it on my own, but around like I find around like session 3, 4, as clients start to become more comfortable and trusting of me, they will, a lot of them have a history with disordered eating, and disordered eating behavior. So it eventually comes out. And I usually always ask on day one if there's been any sort of behaviors like that. But as a recoverer myself, it's difficult to talk about that with people who A, are all up in your business, and literally, and B, you don't really know that well. So being really open and honest with your providers is key, because we can then kind of, if you need to look for a therapist or somebody to work with, we can help you with that. If you do need some nutritional counseling, we can help you with that. And all, like as we said before, everything comes together. So really getting that team behind your recovery, your pelvic floor health recovery, is so, so important.
I see a common theme kind of coming back
Mm-hmm.
to the importance of finding a strong team, because there are so many different parts.
Yeah,
And I think it would be I think it would do a little injustice, not to mention sexual trauma as a contributor
mm-hmm.
in some of these cases. And
Absolutely.
one of the things that, may be a different checkbox looking at somebody's history, but can't really be untied from kind of addiction or eating disorders, just because unfortunately those things are so commonly interwoven. And I don't know that it serves to say that one caused the other or the other caused that one. It sounds like trust ends up being really important when you're doing pelvic floor work with somebody.
Absolutely.
Now, going to a pelvic floor therapist, does that automatically mean that the work has to be internal?
Depending on who you're going to, I know everybody has different methods. For me, no. Like for my younger client, my 14-year-old, I don't do any internal work with her. I always ask for consent on day one, written and speaking. Like some days I like to me, building that rapport and that trust with me is more important than getting the entire exam done in one day. I want you to feel comfortable. I want you to relax because honestly, if you're uncomfortable with the internal piece or there is a history of sexual trauma that we haven't uncovered, me going right for everything is not going to bring you to where you want to be. And it's just not my way of doing things. So your therapist should be clear about whether they need to do an internal component and make sure to double and triple check with you that that's okay and that you're comfortable with that.
That's a fantastic and I think a really powerful philosophy because unfortunately there's another term called medical trauma that exists for a reason.
Exactly.
Yeah. And for those of you who might not be familiar, medical trauma is when you go to a healthcare provider to try to get help, especially if it's with something sensitive. But either because it ends up being so rushed or there's not good communication, then that unfortunate event can end up being re traumatizing instead of helpful. And
Absolutely.
I think that might be one of the things that kind of causes people to shy away from getting help if they've had a negative experience in the past.
Hmm. Yep. And then a lot of times, this isn't very well known either. You know how people will carry tension in their jaw or their shoulders? A lot of clients who have had a history of trauma will carry that trauma in their pelvic floor, which could actually be contributing to symptoms. Yeah. And it's just a lot of people don't realize that that's actually a thing.
That's really interesting. That's actually not something that I'd kind of thought about before, but it makes a lot of sense.
Hmm. Especially with a history of sexual trauma.
So if there's somebody at home who this is kind of sounding familiar to, either going through too many pads on a non-period day or wetting themselves during exercise or waking up and stripping the bed and it never happens. If this is sounding familiar, what's the best way to reach out for help? Because in today's world, there's almost too many options to know where to start.
Yeah, there are a lot of options. So, I'm very thorough in everything, and it's probably exhaustive, but this is also your health and your life, so you want to be thorough in who you're picking to help you. Um, Granted that you've had an exam and you've cleared like the issue of whether you have bladder infection or anything underlying first, we do most states have what's called direct access where you can see a physical therapist for a certain number of visits or a certain number of days, whatever comes first, without an MD script. Or you could also ask for a script from your OBGYN if you think that pelvic floor PT is right for you. And the way I would suggest finding a provider is interview your providers. Go and visit the office. Do a quick Google search, make a list. Don't always opt for the one that's closest to you physically because that doesn't always mean they're the best for you. You want to also make sure that your provider specializes in pelvic floor dysfunction and you're not just going to a run of the mill PT clinic, because part of the reason why I started my own practice is because I've worked in those run of the mill PT clinics pretending like they offered pelvic floor therapy and they didn't. So really know who your providers are. And if you ever have any questions, you can reach out to somebody like me or Miles. I'm sure we'll be able to help too. And we can do some research for you and let you know what your options are depending on where you live. Another site that I really love is called pelvicguru.com. There's a whole directory there. So you can put your city, state, and then it'll come up. And then you can just click through the websites and see which one appeals to you. I always refer to that spot too.
I like that. I hadn't heard of that pelvic guru. That
Yeah,
sounds pretty cool. I think I will put that in the description.
It's run by Tracy Scher. She's a physical therapist in Florida. She's awesome.
Awesome. Yeah, no, it sounds like she's awesome already if she's put together something that makes it easy to access good help. Because
Hmm.
oftentimes it seems like that can be such a barrier in and of itself.
Right.
Like I'm sure that going through pelvic floor therapy isn't always a cakewalk, but getting into treatment in the first place can be a little bit daunting too.
Absolutely. And make sure that your provider is listening to you because there's a lot of talking involved. And there needs to be because it's just so important in this field of work. So you really need to be comfortable with them. They really need to listen to you and they really need to help formulate your goals with you and not goals that like an insurance company is setting because the insurance company is not living your life. You are.
Awesome. I love that. And I think you and I are very much on the same page about the provider patient or clinician client relationship
Mm-hmm.
where as a provider my role is to help people navigate the roadmap to their goals, to what they want for their best life.
Absolutely.
And kind of as a neutral example, it's not always the same for everybody. So for me, I don't mind wearing glasses. Clearly, I like wearing glasses. They're easy, they're stylish, um, and they don't get in the way of my life. So kind of glasses most of the time are the right answer for me. But for somebody else who may be really bothered by glasses for whatever reason, the right answer for them might be getting laser eye surgery. It might be contacts. And the tricky thing about finding the right provider, using this analogy, is are you finding a provider who's going to ask you the right questions to see if glasses, contacts, or LASIK are best for you?
Mm-hmm.
Or are you finding a provider that just gives you glasses?
Right. I like that analogy.
Yeah. Feel free to use it. I'm all about the free dissemination of information, and I think it's a lot less emotional for some people
Hmm.
than some issues that might feel heavier.
Right.
Maybe unless somebody's recovering from botched laser eye surgery and they're like, I wish I just had glasses.
Yeah.
But I think it's a nice way to illustrate that what's right for me might not be right for you, and that's okay.
Hmm.
It's just figuring out that navigation.
Right.
So if somebody's thinking about bringing it up with like their primary care physician, do you have any suggestions for kind of how to broach that conversation?
Mm. I don't know. Like, I guess just be yourself. Just tell them what's going on. And say, you can even just say, listen, I think I have urinary incontinence. You can use that term. I know it sounds scientific, but just use that term. It's very professional. And then if they ask you, most of the time they won't even ask for symptoms. They'll just be like, okay. And you just say, I just want a script for pelvic floor physical therapy. And they'll just write it. That's just my experience. Primary care is pretty open with giving us scripts. So, but yeah, just own like I know it's easier said than done, but really just be mindful of what's going on and just own the fact that you deserve to get answers for whatever doesn't feel right in your body at the time. And it might feel uncomfortable to bring it up to somebody like a primary care physician, but at the same time, if you don't how is it going to feel if you live with this when you could be getting help? So that's my 2 cents on that one.
Sounds like you might have had some mixed experiences with primary care doctors,
Can you tell?
which is it's so unfortunate, and at the same time, kind of like you talk about working in kind of an insurance reimbursement driven clinic in the past. At the same time, there's this balance of knowing how hard it is to meet productivity requirements and feeling rushed your entire day at the same time as being aware that this is not how medicine should be.
Right. Exactly.
And sometimes we have to get creative working in today's system to try to advocate for yourself and your health,
Mhm.
as well as navigating it as a provider, which is like a whole nother talk for a whole nother day that we'll save.
Absolutely.
So if somebody is struggling with incontinence, pain in the pelvic floor area, is there anything that they can do at home to kind of help take care of themselves or reduce harm before they can get in to see their provider?
So the major thing, and this goes with any type of incontinence and pelvic pain, I think, is anything relaxing because incontinence and stress are very closely related. And in times of high stress, your likelihood of leaking if you do suffer from incontinence is higher. So if you can do any type of meditation, any type of relaxation, breathing exercises, even just lying on the floor with soft relaxing music, your legs draped over a pillow so your legs are falling out, and just breathing, being mindful of your breath, doing that belly breathing, filling your ribs up with air, filling your lower back up with air, and just like taking 20 minutes to relax is, it sounds so hokey, but it does so much just to tide you over until you could go in and see someone. But I think relaxation is so important and we don't do nearly enough of it.
Definitely. I think there's a lot to be said for just giving yourself permission to not be doing things
Yeah.
for 20 minutes, not be running around, or I guess in today's environment, even, scrolling on social media can be
That
kind of
stresses me out.
stressful.
Yeah.
Yeah. Depending on what your social media is.
Mm-hmm.
Um, but yeah, I think that giving yourself permission is the hurdle for a lot of people.
Absolutely.
But I'm glad you brought up the meditation component, because that's one of the other hats that I wear, is right now facilitating, I think it's between 3 and 4 free open guided meditations every week, and it seems like
Ooh.
people are really connecting with that during quarantine,
Mm-hmm.
which has been a weirdly stressful experience.
Quarantine stressed me out like nothing else.
I think it's safe to say that this has seemed like the longest year I've
Yes.
ever lived halfway through. I don't know if that's been your experience,
I
but when I
totally agree.
when I think back to January and February, it seems like I was in my youth and so naive to all these realities.
So true.
Oh, goodness gracious. But as we navigate healthcare, both from the provider side and from the client side, teletherapy has been such a help
Mm-hmm.
during this time. Is that something that is compatible with pelvic floor therapy?
Yes. So I always give this disclaimer. For anybody who's looking for virtual services, I do a free consult first, just to see if telehealth is appropriate. Because sometimes, if you can't voluntarily contract those muscles or relax them, then you might need manual work where it's one on one. But I actually do have a couple of telehealth clients right now who are suffering from incontinence, and the progress we made, like they were so skeptical in the beginning because they're like, how are you going to help me if you're a PT and you can't touch me? And I'm like, we could do other things. And they're doing so well, and they're just like amazed that this is actually a thing that can help. But absolutely, depending on the client, it's definitely a great avenue to explore.
That's really encouraging to hear, because I run into that a lot too, where I think telemedicine and telehealth is very new to the general population,
Mm-hmm.
uh, even though there's been people that have been doing it for years and decades. And so it's been helpful to have that open conversation and have that become a little bit more visible in the public sphere.
Right.
And it's really encouraging uh, that if you're not wanting to see somebody in person right now,
Mm-hmm.
there's still a lot that you can do. And oftentimes, kind of like today's conversation, I think some of the most valuable aspects of, like, shh, don't give all the secrets away. But some of the most valuable aspects of care are education, goal setting with people for their goals,
Absolutely.
and breaking it down so it doesn't seem like this big daunting thing that, how am I ever going to do this? Breaking it down to a point where it seems like, okay, I could do that. I could do
Mm-hmm.
that this week. And I think that can really help people get over those mental hurdles of, not feeling like they can give themselves permission to do some self-care for 20 minutes a day, or not feeling like they have the time or the ability to set, you know, 5 minutes aside and do some pelvic floor strengthening every time they go to the bathroom to help keep that regular
Mm-hmm.
exercise into their day.
Right. And then a lot of people also don't realize that in physical therapy, you're supposed to be learning how to use your body to your advantage. If I have to have my hands on you to fix you, I'm not doing my job and I'm doing a disservice to you. So telehealth actually takes that a step further in that I can never put my hands on you and do the work. So your body creates that roadmap to kind of like learn what to do on its own and more efficiently.
I love that, and I think it speaks to what another outspoken MD, who's a nice one, talks about as being the future of medicine,
Hmm.
where it's so important for people to understand that it's their body, they have bodily agency, and ultimately the goal is not to go get fixed by somebody. It's to get the support that they need to be a good steward of their body and learn how to take care of it in the future.
Exactly. Hmm.
So if people are hoping to get in touch with you, if people are tired of wetting themselves at the grocery store or stripping the sheets, how can they get a hold of you?
You could go to yournewquest.com, which is my website. All my contact info is there. I'm very active on Instagram, so it's Dr. Mel DPT. You can find me on there. Yeah, either way works.
Awesome. And based on our conversation today, it seems like, you try to be, really engaged and really positive about answering questions, which, I try to too. My hope for the future is that, you know, the same way that teletherapy got a big boost in 2020, my hope for the future is really that pelvic floor therapy and pelvic floor problems become as easily conversational.
Oh my God, I love that.
Yeah. As, people talking about their knee replacement or people talking about their frozen shoulder,
Mm-hmm.
people feeling like they're able to broach those topics so that they're
Right.
not suffering for, years or decades with the same problem.
Mm-hmm. And just knowing to when to accept something as being normal versus being common. So the more educated you are about it and the more you educate each other, the more everybody knows like what they can get help for and what is more so considered normal.
I love that, and I'm all for kind of the power of open discussion, right? And the
Yep.
free dissemination of information, I think is fantastic. And my hope is that tonight we've helped kind of broach some of this because, like we talked about earlier, I was looking for information on the intersection of pelvic floor problems common in eating disorders, pelvic floor problems common with substance use, and not finding a lot, even though I hear about it a lot from people who are struggling with it.
Right.
Any last thoughts you'd like to leave folks with before I take too much of your time tonight?
Oh no, this is so much fun.
Yeah.
Um, just the only thing is you really need to be your own advocate. You need to stand up for yourself, ask questions, call BS on things you think are BSing you, even if it's with your healthcare provider, and get comfortable with your body. Like a lot of people learn to ignore signals and they just write things off until tomorrow instead of addressing things now. So that's my main takeaway. And if you guys have any questions, please feel free to reach out to me. Nothing is weird. People are always like, oh, this sounds weird. I talk to my clients about their poop schedules and what the poop looks like. So anything goes.
I love it. I feel like the poop schedules is a nice place for us to wrap up the conversation tonight. So if you have any more questions for Dr. Mel, if you have any more questions for me, the contact information is going to be in the description box. And feel free to share with anybody who might be struggling with one of these issues or might not know how to broach that in a conversational way with their provider.
Mhm.
I want to say thank you to you for being willing to have such open conversation. It's refreshing.
Oh, thank you so much for having me. I love talking about this stuff and educating. So this was so much fun. I loved it.
Awesome. Me too. So feel free to leave any questions after the fact, folks, and we will do our best to get back to you. Otherwise, I hope you have a good night, Dr. Mel.
Thanks, you
And
too.
yeah, everybody take care.